Questions, general questions? Yes, sir. Please come forward, state your name.
Hi, good morning. My name is Justin Danhof. I'm General Counsel with the National Center for Public Policy Research. Today I'm representing my colleague Amy Ridenauer, who's an Aetna shareholder. Mr. Bertolini, back in January, CNBC reported that, quote, Obamacare has failed to attract the uninsured, and that you personally offered a scenario in which Aetna could be forced to pull out of the program, end quote. Poor exchange mixes could also increase the likelihood and the amount of a taxpayer bailout of health insurance companies. As you know, Obamacare's risk corridor provisions require companies that make a profit on the exchanges to use some of those profits to help insurers who take a loss on the exchanges. However, if there are more losers than winners, then the taxpayers must step in and help the insurers who have incurred losses. Thus far, the CBO predicts that risk corridors won't cost taxpayers any money, but the CBO has been wrong before. And after they made that score, in March, the Obama administration proposed yet more changes to the ACA that may increase this potential bailout for insurers in 2015 by ballooning the amount that taxpayers may have to pay insurers for company losses. Concerning these potential bailouts, you have stated that, quote, whether or not there's a government bailout because we lose some money on members is irrelevant to us from our standpoint of earnings, end quote. Well, I'm here to tell you this potential bailout is certainly relevant to the American taxpayers who may have to foot some of that bill. So my question is quite simply this. If the situation arises where Aetna qualifies for taxpayer money through the risk corridor provisions, can we get your promise that you'll reject taking taxpayers' money?
Well, I think, Mr. Danhof, that you're referring to provisions of the ACA for reinsurance risk corridors and risk adjustments. These protections are good for everyone insured through the exchanges, and they are as good for you as our shareholders. The reinsurance and risk corridor provisions provide financial protection for participating health plans for only the first 3 years of the health insurance exchanges in order to provide stability of those funds and those pools so that subsidies by the government won't have to be increased in order to take care of those that cannot afford their own health insurance. Should the exchanges attract mostly sicker people, these tools are necessary to help prevent large spikes in premiums, which create large spikes in subsidies. The fees for reinsurance are collected from employers at $63 per employee per year and are neutral to the payout. So if the funding exists, it gets paid through that fund. If it doesn't, anything in excess cannot be paid over the 3-year time period. So to the degree that there are funds available and we believe we have reinsurance exposure, we would take it from those funds.
Okay. I guess a quick follow-up then.
Sure.
Can we get your assurance that after 3 years, Aetna and the industry won't lobby to keep the program going?
That all depends on where the program is.
Okay.
So what we want, we believe it's appropriate that people that can't afford insurance and get access to health care should be covered. And what we want is a stable program, and our whole aim is to improve the program as we move forward instead of making it more of a taxpayer-funded program.
Right.
So that is our aim, and that is my aim personally, is to make it a better program than where it is today.
Okay. Thank you.
You're welcome.